We're live. Hello and welcome to another episode of the Dr. O Show. This is for the week ending on 1/24/25, and what a week it was. So Monday was a pretty busy day on the 20th. My team, oh, where is it? Where are we here? The Ohio State Buckeyes, who I've cheered for since as long as I can remember, won a national championship in the first ever 12-team playoff. So really exciting. I watched most of the game. I had to put the kids to sleep, my girls to sleep while part of it was on. So I actually missed the big 70-some yard rush by Judkins. But so I missed that series, but really exciting game and happy for the guys. It's fandom is weird. So I have no association with the team. My life is not affected by whether they win or lose. But when my teams win, I'm happy. Like, yay, it's great. On to the next year. But if they lose, especially if they lose in a way that seems like they were wronged, I am so emotionally devastated that a lot of times I can't sleep at night. Like after they lost to Michigan this year, and Michigan was the far inferior team to Ohio State, and I was thinking about that as I would go to sleep at night for at least 2 days. And it's ridiculous. Like, who cares? It has no effect on my life. So the losses affect me way more than the wins. I remember when Ohio State played against LSU in the national championship years ago. They got up pretty big, maybe by 2 touchdowns, and ended up losing. I was like, I had a hard time sleeping because I was so upset that they got shafted or whatever. But still exciting. And the rest of 120 was really busy. So we had the inauguration. So now we have a competent president, not one who is obviously demented, and who knows who was running the country these past 4 years. So hopefully we got a good 4 years coming up. So that happened. At the same time, like, who schedules this? The national championship game and the inauguration, or like happening at the same time. I just don't get it. And then it was Martin Luther King Jr. Day. I do not get that day off. I try to do those out of office videos where I title them OOO. That's out of office, but didn't do one of those videos because I was here at work. And it was also my anniversary with my wife. So we didn't really do a whole lot. We were watching TV. I've been sick all this week. I started getting sick on maybe Sunday. And I was looking back through my running log, and I have been coughing since December 17th. I had a pretty bad cold. It went through the whole family. And I've been coughing that whole time, and it's been gradually creeping down. But here, then I get another cold. So like the coughing goes down, and now it's going up again. Although this is more of like a little bit of sore throat and more runny nose, or what we call rhinorrhea. So it's a pretty mild cold, but it's still annoying that I've been symptomatic for weeks. And I'll have a lot of patients who will contact me with, hey, you treated me with whatever treatment for this upper respiratory infection, and I'm still symptomatic. What do I do? And generally, when I treat somebody, I give them everything I think they'll need to get better. But the first question I'll ask is say, well, do you still feel sick? Or is it just that you have this cough still? Or is it just that you feel congested still? And almost always it's, oh, I don't feel sick anymore. I just have these symptoms. So you can get a persistent cough or congestion, and that's usually due to some persistent inflammation, or in terms of cough, like airway spasticity. So you can have symptoms go longer than the actual infection. So you don't necessarily need another round of antibiotics if you're still coughing. It's probably just that you're getting that mucus out, or your lungs are spastic on you. So then we had the super cold air, like the polar vortex. I had done a video about cold weather exercise a few weeks back, but not this week. It's been bad. The wind chills and the negatives. So I've been on the treadmill for that, and seeing pictures of southern states and southern stadiums being covered in snow. That's wild. Like New Orleans, it's crazy. Starting to finally dig out of that cold weather, but it's been bad. Did another video earlier this week about, I was freezing a wart. I shaved off some of the extra skin and I froze a wart. And I thought I'd say a few words about the HPV virus, or the human papilloma virus, I should say. that causes those. So there's all sorts of strains of HPV, and basically we generally get that infection through human contact. The more partners we have, the more times we swap HPV. And there are certain strains that cause warts on the hands, certain strains that cause warts on the feet, the plantar warts, certain strains that cause warts other places, and even things like cervical cancer. So usually you have to have a skin abrasion. So they're really common on fingers and feet. So depending on your activities with your hands and the contact with that virus, you can get infected with it. And a lot of times your body clears that. Your body's immune system recognizes that there's a foreign virus presence, and it can knock it out. That's why we don't do cervical cancer screening on girls quite as young. We wait until 21 because they found that these young, healthy women were clearing the virus on their own, and we were subjecting lots of young, healthy women to procedures on the cervix that they didn't need. So, but once you get that wart, it's very hard to get rid of. So a lot of times we do have to shave them off, cut them out, freeze them, laser them, and that's what that patient needed. So I hope that worked, because it stings a little bit. And then I had another patient this week. He asked me about prostate screening, in particular, digital rectal exam. That's where we take a gloved finger, insert it into the rectum, and like the prostate lies on the other side of the colon. So through palpation, you can feel through the colon and onto the prostate, and you can feel for nodularity. It actually kind of feels like your palm. It's kind of the same consistency, a healthy prostate. And I was telling him, there's that cough, that's something I'm capable of doing, this digital rectal exam, but I haven't done it in years because I almost always opt to do the blood test, the prostate-specific antigen in the blood, during a yearly physical where we're drawing blood anyway. Even though I've been blessed with slender fingers, I don't want to do it necessarily. The patient doesn't want to have it done, and I trust the blood test more than my subjective sensation of, okay, does that feel boggy or does it feel normal? So I've kind of gotten out of that. And the people who make recommendations for what doctors do with prostate screening, they keep changing their minds. Yeah, you should do the digital rectal exam. No, it's okay to do the PSA, or it's your choice, or they keep changing their minds. So I go with that more objective test, and I don't think, knock on wood, that I've missed any prostate cancers doing that, because if I find that the prostate number rises, I can act on that, either retesting in a couple of weeks or sending to urology. So that's kind of my strategy there. But a digital rectal exam is always available upon request. Just hope that we don't need to go there. But I'll do what I need to for my patients. So I just got off a Microsoft Teams meeting for a potential new clinical trial to be a part of. One of my side gigs is that I will be the lead investigator for a clinical trial for various medications, basically looking into either safety or efficacy, or those are the main things, tolerability for different medications before they come out to the general public. So we had a meeting about a potential new study for that. That'd be pretty cool to start off with. But that's all I've got going for the day. So have a great weekend, and I'll talk to you guys later.